Another study that we were happy to bring to this GU ASCO 25 was a study focusing on the impact and on the role of symptoms, paraneoplastic syndromes, and abnormal lab values in renal cell carcinoma before surgery. We already know that almost half of patients with renal cell carcinoma have an incidental diagnosis, but the other half, of course, they're symptomatic at diagnosis. And of course, we already know that these are the patients that are associated with an impaired survival. What we wanted to do was basically develop a predictive model, a predictive score, which we called primal score, which was able to predict, based again on these symptoms and abnormal lab values, that was able to predict overall survival and cancer-specific survival at diagnosis before surgery. We relied on basically 4 centers, so it was a retrospective multi-center study, and we were able basically to develop this model, which included the most common, if we want to say, symptoms at diagnosis. So, for example, anemia, hematuria, but also some markers. We can say, for example, the elevated NLR ratio, but also the elevated neuritis ratio. So we developed this model, and the results that we got were amazing, because we were able to obtain like an area under the curve, so an accuracy in predicting both overall and cancer-specific survival of 0.7 and 0.74. And also, as a comparison, we were able to compare it with a Leibovitz score, and we basically found that they have comparable accuracy, and in some cases our score is even better in some cases, which is super interesting, because it means that solely relying only based on the symptoms at diagnosis, we were able to obtain an accuracy which was comparable to the Leibovitz score, which uses, again, the T, the N, the M, basically pathological data. So that was very interesting.